everyone, and good afternoon and good morning, good evening. We have a lovely sunny spring afternoon here in Wicklow in Ireland, and I hope the weather is fine where you are. Thank you very much, Ron, for the opportunity to talk and present on the work of the Irish government on implementing the EU Web Accessibility Directive. And I'm delighted that there is a session on the directive at AxCon this year. I think it's one of the biggest developments in the web accessibility world over the past couple of years, and great to have the opportunity to present our approach about this in Ireland, and also through the chat learn about what other countries are doing, or even what people's view of what we're doing in Ireland is. So Ron, I'm going to go ahead and share my slides, and please do keep me to time. So just by way of introduction, my name is, as I said, Dónal Rice, and my role is as Senior Standards and Monitoring Officer with the National Disability Authority in Ireland. The NDA is the statutory body providing evidence-based advice and research to government on disability policy and practice and promoting universal design. And within NDA, I'm located within the Centre for Excellence in Universal Design. And our disability legislation in Ireland is unique in having a definition of universal design and setting up a statutory centre. So universal design is about enabling the design of environments that can be accessed, understood and used regardless of a person's age, size, ability or disability. So I'll actually circle back around to universal design towards the end of my presentation. But for now, I want to talk to you about the Web Accessibility Directive and how we're approaching implementing it in Ireland. And of course, none of this would be happening without the wonderful EU Web Accessibility Directive team and NDA. So on the team, we have two reviewers, Ben Adamson, who looks after the in-depth reviews, and Jess Byrne, who looks after the simplified reviews. On comms is Denise Green, who helps us communicate with all the public bodies that we need to do. And our admin person is Rosemary Burke, who basically does everything else on the team that needs to be done, and myself. Ron, as I was explaining to you earlier, today is a little bit of a sad day in Ireland. We lost one of the giants in the accessibility community, who was buried, whose funeral is today. And thinking back to Preeti's keynote opening speech yesterday, where she spoke about us standing on the shoulders of giants, well, certainly in Ireland, we're standing on the shoulders of Jerry Ellis, who, as I said, passed away, and his funeral was this morning. Jerry was a huge friend to the centre and a massive advocate for accessibility. He was a software engineer, and he worked with a large bank in Ireland, but he also was involved in setting up many organisations that have been hugely influential in Ireland around the area of accessibility, including the Vision Impaired Computer Society. So I'll dedicate this presentation, such as it is, to Jerry. I think he would want to be remembered on a day like today. On the screen is an artistic rendition of Jerry speaking at an event called Inspire Fest. He was a fantastic public speaker. And there's a speech bubble giving one of Jerry's quotes, which says, "Unity is our strength, but diversity is our wealth." So as we say in Irish, Ar Yeishde go raibh a Hanam Dílis. Rest in peace, Jerry. So with that, I would like to talk to you about the directive and the work that we're doing in implementing it, and how it's been such a new departure for Ireland and for EU member states. I'll talk about our role in NDA as the national monitoring body, and our approach in implementing the directive, and some of the challenges and successes and lessons we've had. So to kick off, let's talk about the directive. It's a directive of the European Union, and requires that public bodies in member states ensure that their websites and mobile apps are accessible to persons with disabilities. The directive has a number of components, including two things that are called implementing decisions. And these are basically detailed documents that set out how aspects of the directive need to be implemented. One implementing decision sets out an accessibility statement, what it is, and provides a template for it. And the second implementing decision speaks about conducting reviews and contains a lot of very prescriptive information on how a monitoring body should conduct reviews, the scope of those reviews, the numbers, etc., etc. So unlike other directives that are transposed in member states, this directive is quite specific and prescriptive in what a member state needs to do, and in particular, what a monitoring body such as my organisation needs to do. It was transposed into Irish law in September 2020, and some core aspects of it, in common with other directives, it sets out a set of essential requirements, what must be done. And the directive essentially says that public bodies, websites and mobile apps must be perceivable, operable, usable and robust. So we're all, I'm sure, familiar with those four principles. But then what does that mean and how do you prove that? Well, it sets out what's called in EU parlance what a presumption of conformity is, and sets out a European standard, EN 301549, against which a public body's website or app can be assessed. But the implementing decisions also provide details for an accessibility statement, which public bodies are also required to implement. So it's very standards-based and there's very prescriptive monitoring in the EU Web Accessibility Directive. And public bodies are required to do essentially four things. One I've already covered, which is ensuring that their websites and mobile apps comply with the standard EN 301549, which is roughly equivalent but not identical to the Web Content Accessibility Guidelines AA. So there are some additional clauses in the annex of the standard that public bodies must adhere to, including some items around video players and the provision of accessible videos. As I said, a public body is also required to provide and maintain a detailed accessibility statement, and that needs to have some meaningful information in it. I sometimes still get a smile out of seeing accessibility statements on websites that say completely meaningless things like how to include, how to increase, how to zoom in on the web page using the browser, or what the organization's commitment is, and very often to accessibility, and very often they'll reference a completely outmoded or outdated standard such as WCAG 1.0. Instead, the accessibility statement under the directive has to include quite detailed and specific information about the accessibility of the website, what parts of it are not accessible, where someone can go to get help, where someone can go to make a complaint about the website, and other useful information. And the fourth leg of the directive is around organizations building capacity and awareness of web accessibility and engaging with end users. So those are the four components of the directive that a public body must adhere to. So what's covered? Well, as I said, it's websites and mobile apps, but it's quite a broad scope of content that's covered. So it includes Office file formats, such as PDFs. It includes videos, includes embedded content, and it also includes what the directive calls intranets and extranets. And that's a really interesting component to the scope of the directive, because it means that systems such as virtual learning environments are now subject to monitoring. And we're in the process of working with a couple of universities to start monitoring their VLEs. So what's exempt? Well, I've already mentioned Office file formats such as PDF, but if they were produced before September 2018, they're exempt from the directive. unless they have a particular relevance to persons with disabilities. There is an exemption for live media and maps and items in heritage collections. And there's an exemption for third-party content not under the control of a public body. Now, that does not mean a third-party widget that the public body is using on its website, such as a cookie banner or a feedback mechanism. If that is provided and paid for by the public body, that third-party widget is in scope. But if there's content published to their website that they have no control over or republished from another organization, they're not required to ensure that that's accessible under the directive. And finally, there is a slight exemption for extranets and intranets. They are not within scope if they were developed before September 2019, until such time as they undergo a significant redevelopment. But any of the organizations we've been working with to look at their VLEs, for example, they've updated them the past few years, so they're now all gradually coming into scope of the directive. So I just want to outline what the functions of the national monitoring body are. And as I said, the directive is really prescriptive in terms of what a member state must do around monitoring. So for us as the national monitoring body, we needed to establish a monitoring methodology, and it was important that that was transparent and replicable, understandable and impactful. And I'll come back to these kind of principles around the monitoring methodology that we've endeavored to build as we've been conducting monitoring under the directive. We're required to establish a register of websites to be monitored in a given period, and the legislation sets out that a monitoring period is an annual basis. So every year we need to establish a register of websites and mobile apps to be monitored within that year. And then it requires a certain number of monitoring of websites and apps to be monitored every year. And in Ireland's case, it's about 30 mobile and in-depth web reviews need to be done, and about 250 simplified reviews need to be done. And the approach that we took in Ireland was to ensure that all the results that we're getting from the monitoring is communicated back to public bodies. So we're not just giving them information and numerical data on their compliance, we're actually giving them all the data that we gather as part of our monitoring activities. And we're open to answering queries in that regard as well. And of course, we need to collate a report and submit it to the Commission. The reporting period is every 3 years. So those are some of the core aspects of the national monitoring body that NDA has to do. But we took on some additional roles, I suppose, that are around supporting organizations in meeting compliance with the directive. And that includes informing strategic direction of ICT policy and practice and building awareness, providing guidance and supporting capacity. And I'll talk about that in detail in a couple of moments. It was necessary for us, Ron, to define a process when we began monitoring. So while there's a lot of prescriptive information in the implementing decisions from the Commission, we still had to figure out exactly how to do this. So we set out a process where we conduct the accessibility reviews, the simplified and in-depth reviews. We provide all that data then back to public bodies, whether it's Fáilte Ireland. There's a couple of logos on the screen at the moment. Fáilte Ireland is one public body that we provide monitoring data to, or government departments. But we also need to collate that data into a report for the European Commission, which we've done twice now at this stage. As I said, the monitoring methodology is really prescriptive, and if people want to look this up, they can, but it defines things like the types of websites, the scope, the numbers, how often, and how member states should report on it. So in 2022, because Ireland was late to the table in implementing and transposing the directive, we actually had a higher number to do last year than we would ordinarily have to do. And we had to do in the order of about 400 simplified reviews, 40 in-depth, and about 14 mobile app reviews to make up for lost time in Ireland implementing the directive. And just to clarify what I mean by simplified and in-depth reviews, a simplified review is a review that's conducted on a large number of sites, but only over a subset of the Web Content Accessibility Guidelines. And the way we've approached this is that we use a product from DQ called Axe Monitor, and we run these scans weekly, and we give every public body read access to their scan results. So simplifieds are fully automated. They cover a large number of pages, usually in around 400 pages per site, and we need to do about 250 annually. Simplified reviews cannot tell an organization or whether an organization's website is compliant, okay? So for it can only detect errors, it can't detect compliance, and that's an important point. In-depth reviews, on the other hand, are much more detailed. They're done on a much more a once-off basis, and we conduct it on a sample of pages. But when we inspect the pages, we inspect every single WCAG success criteria and EM 301549 clause on those pages. So we can assess whether those pages are compliant or not. And we do about 20 of those on websites and about 10 of those annually on mobile apps. So quite a difference between the two different types of reviews there. When we set up our monitoring methodology, we were very careful to ensure that it was transparent. I was quite concerned at the beginning of this that as we were producing all this monitoring data, that perhaps we were going to get into conflict with web design agencies and large contractors for government bodies who were saying, well, we have produced something that's compliant. This is just your view as to what compliance is. Well, that's not the case. And we've been very careful to ensure that how we conduct reviews is very open and transparent. And that's why we favor testing engines such as Axe Core, because they're open source and we can point to the rules, and there are other tools that use those, not just the one that NDA uses. It's important that it's reliable, and you know, it all comes down to detail a lot of the time, Ron, in working with these public bodies. So if we find a large number of color contrast issues on a public body's website, it's important for that public body to know that that data is reliable and that they need to go and spend time and sometimes money in fixing those issues. And that it's important as well that the data is usable by the public body. I mean, we were really starting off at ground zero in Ireland when the directive came into place. There had been no meaningful monitoring done around web accessibility in Ireland really ever. And our sense was that a lot of public bodies didn't have any data on the accessibility of their website. And hence we did all the monitoring ourselves and provided all the data back to public bodies. We spent quite a lot of time setting up the monitoring methodology and doing market research and discovering who the key players were. We tested different tools and tool offerings, and we went through a transparent public procurement process then to ensure that what we did was fair and equitable to all market players. But we identified some accessibility partners. DQ is one, but there are others as well, such as Interaccess and AbilityNet, and some other partners that we work with on an ongoing basis. I mentioned about using data and providing data, and we're very much using the data that we're gathering through the monitoring as a way to drive compliance. So for the in-depth reviews, every public body gets a dashboard of its results, the details of the issues, their location, guidance on how to fix them, etc. And for the simplified reviews, we do the same. They get a dashboard of the results. These are updated weekly, however. And what we're seeing is gradually over time, those public bodies that are engaging with this are improving their accessibility and reducing the number of errors that we detect on a weekly basis on their websites. So again, our approach with engaging with public bodies is that we conduct the reviews, whether they're simplified or in-depth, and we issue a formal notice of monitoring to the organization about the directive. And for most organizations, we sent out these statutory notice of monitoring. They'd never heard of the directive. So we had to engage with them and explain to them what it was. One of the things we did was to set up a platform. We call it our monitoring and reporting platform in NDA, for every public body to self-register. And then they receive guidance and training on the directive and on web accessibility and mobile app accessibility. But it's also a way for us to give them their results. We just set that up late last year, and so far it's working quite well as a way for us to communicate with our public bodies, for them to send us queries, for us to send them out notices about events and training and other technical information that they may need. And the results from all our monitoring then is used for our reporting obligations to the Commission. We've also undertaken quite a detailed program of capacity building. And it was this month last year that myself and Jerry Ellis did a presentation on the business case for web accessibility as one of the webinars that we've done. But we've also worked with the Irish Computer Society, with AbilityNet, to provide, I would say, probably about 12 webinars or seminars at this stage over the past 18 months on everything from introducing the directive to public bodies, to understanding the detail of the data that they're getting, the monitoring data that they're getting from us. We're also in the process of providing licenses to DQ universities to public bodies. And we held off until now to doing that because I think a lot of public bodies, it took them a little bit of time to recognize that this wasn't just a once-off project that NDA was undertaking. It's now part of their governance stack. They need to pay attention to it, and they're going to continue to be monitored. The directive is not going anywhere, so they really need to do something about it. And now we're seeing good take-up of the DQ university licenses by public bodies as they begin to build capacity within their own organizations. Our latest monitoring report was sent to the Commission late last year. It was, in fact, completing our monitoring for 2021. We had to make up quite a bit of time as we were late implementing the directive, and thanks to the patience of the Commission, they gave us a little bit of leeway in making up the numbers of reviews that we need to have conducted last year. And we conducted a huge amount of reviews, and we conducted, I would say, well north of 200,000 reviews on pages, or pages were reviewed. So it was interesting to hear Dylan Barrell talking about, that there's 50 million pages monitored in Axe Monitor. Well, we certainly accounted for, I would say, close to 250,000 of those pages last year using Axe Monitor on all the websites that we needed to conduct simplified reviews on. We conducted quite a lot of in-depth and mobile app reviews to make up the numbers. And we collected a huge amount of quantitative data on simplified and in-depth reviews. And to be quite honest, we didn't quite know what to do with all this data. We had, in some cases, tens of thousands of data points on each website. And when you combine those by the hundreds of websites, we had literally millions of data points that we needed to make sense of. And with your help, Ron, we spent quite a lot of time last year thinking about it and looking at other monitoring reports that member states were doing. When you're late to the party, you can learn from what other countries are doing. We came up with some really nice ways to present that data, including providing comparative data. So here's just some figures on the data that we collected. On average, the number of pages we tested last year was 704 pages. And the number of sites we gathered were average number of errors per site was 9,847. So a huge amount of data. So what to do with all of that? Well, one of the things we did was we took sectors such as our local government sector, and we compared how each of these local authorities are performing in comparison to each other. Now, that's a really good motivator for any public body to not just see what your own level of compliance is, what your own number of issues are, but how your neighbor is doing and how other organizations similar to yourself in size and scope are doing. And that's been quite effective in motivating and communicating the issue. So what were the issues that we found? Well, the top 3 issues are probably going to come to no surprise to anyone who's been in the web accessibility testing world. Number 1 was color contrast. Number 2 was PDF accessibility. And number 3 was name role value as it applies to interactive forums on sites. So it really was a huge exercise in gathering data and taking the pulse of where public sector websites and mobile apps are in Ireland. And the impact on that is that there's been a really significant increase in awareness by public bodies in Ireland around the directive. And I think that there's now greater accountability of web design agencies. I've been encountering a phenomenon called monitoring shock, where public bodies thought their website was compliant. Then we do a simplified or an in-depth review on it, and they figure out that actually it isn't as accessible as they thought it was. So we've had practically no pushback from any web agency or public body in Ireland around this, which is really gratifying to be able to say. Those public bodies that are engaged are just getting on with it. They're working with their design agencies. Some of them are changing web design agencies, and they're working with them to improve the accessibility of their website. NDA is an independent government agency. We're not located within central government. So it was really important for us to start building relationships with key organizations such as our National Health Service, the HSE, such as our Government Chief Information Officer, and other large organizations like our tax authority, the Revenue Commissioners. So building those relationships has been really important to us to support them in implementing their requirements under the directive. And I really see the accessibility statements as increasingly containing useful information for users. Some of the challenges have been some inaction by some public bodies. Now, we don't know what everyone is doing. We know how they're complying or the number of errors they have on their website, but we don't necessarily know what they're doing about it. So we're still working to engage with some public bodies, and Denise and Rosemary and Jess and our team are not people who take no for an answer, and are often following up with public bodies to make sure that they're engaging, that they've got their notice of monitoring, that they're taking heed of our monitoring activities. We did find that there was an over focus by some public bodies on the accessibility score. And, you know, for anyone who's been to any presentation about large scale monitoring, data collection, or Axe Monitor, any of these products, you know that, you know, no one communicates that that just doing automated testing is enough. And the accessibility score, which is a numerical score that we provide in our simplified reviews, some organizations have really put a lot of effort into improving that score, a little bit to, you know, the detriment of looking at accessibility in the round. So we're all the time communicating back to them that the accessibility score is not the end goal here. It's housekeeping. It's getting rid of all those errors that should not be there. And now you know that they're there, you can remove them, but it's not the end. It's not the end game. And of course, you know, Axe Core is always being updated. So there's always going to be more and more issues that we find. So I think the message is beginning to permeate out that just removing all the errors that can be automatically identified on your site is not the end goal here. Part of the challenge is that there is no clear methodology for reporting compliance to the European Commission. The directive isn't very prescriptive in that way, but I think we're reasonably happy with how we've been able to present the monitoring data to the European Commission. And anyone interested can read our report, which I think, Ron, you've been providing a link to in the chat, or at least you can. What we did find, part of the challenge for us is there is no off-the-shelf products and services ideally suited for EU Web Accessibility Directive monitoring. I mean, we've worked with our current partner, DQ. We may have a different partner in future, but we've been, to use that term, hot rodding some of the products such as XMonitor, such as XAuditor, such as XDev tools to suit our particular requirements within the national monitoring body. But I think we should see providers out there being a little bit more attuned in their products and services to the EU Web Accessibility Directive and the requirements of national monitoring bodies. So where to now? I think the message in Ireland is beginning to permeate out that digital first, which is essentially the government strategy around ICT in Ireland, equals accessibility first. And just before I came online, I got an email from a very senior person in the Irish Civil Service asking about possibility to meet to discuss the accessibility of a new project that they're engaging on. Quite frankly, that's a level of engagement we never had before until we had the directive and we were conducting this monitoring. So ensuring that things are now produced to be accessible first is going to be a priority for the wider public service going forward. And we want to engage more with public bodies to help them prove compliance with the directive and the EN 301549, continue to support awareness and capacity. And we're just beginning to see what accessibility maturity actually means for a public body in Ireland. You know, each public body is quite different, but a lot of them have got similar characteristics. So I still notice, for example, in the local authority sector, that they still have technical people on staff who are quite technically capable and make a lot of very technical changes to the website, whereas most government agencies, they outsource their web design services. And as well, web accessibility is not just the sole obligation or responsibility of one person in an organization. It spans across communications, IT, marketing, and the three errors that the three most common errors that we identified and detected last year actually speak to that. Color contrast speaks to branding. PDF inaccessibility speaks to content creation, and name, role, value speaks to the more technical code development on websites. So we're seeing that accessibility maturity in public bodies in Ireland, we're just beginning to understand what that can actually mean and how web accessibility really rests on the shoulders of different people in the organization, not just on one department. One thing I'm very eager to happen in Ireland is that the feedback and complaints mechanism is improved. The enforcement procedure under the directive in Ireland is actually the complaints mechanism. And let me explain that. Under the Disability Act 2005, a person can make a complaint to a public body about the accessibility of their buildings, information, services. And that body then has a statutory obligation to address that complaint in a very particular way. The enforcement mechanism under the directive in Ireland is actually taking that complaints mechanism and applying it to websites. So every public sector body needs to have information about their complaints mechanism in their accessibility statement. We're not seeing that complaints mechanism being used at all, or if for some public bodies, and for most other public bodies, very intermittently. So there's a job of work to be done here around engaging with people to ensure that they're aware of their rights under the directive, and that they're willing to make complaints in order for the public body to be aware of what their experiences are. We're going to continue to work with DQ for as long as our contract lasts to further develop methodology for EU WAD monitoring. I don't think we're out of the woods there yet. And we were quite pleased with some positive feedback we got from the Commission, albeit informal, on our approach to reporting. So we're going to continue along that vein and look at how we can use all this data to provide more meaningful reporting. So we're nearly done. I suppose just what lessons have we learned and what advice can we give to government bodies? Well, our key message is start now, because we're not going away, guys. We're here to stay. We've got a really high functioning team that is the Web Accessibility Directive monitoring body in NDA. The data that we're giving out to public bodies can be actioned on today, so there's no need to put this off any further. And it's important for organizations to define what their key performance indicators are. And that can be scorecards or setting organizational goals around web accessibility so that you increasingly improve your compliance with the directive. And what we see with the monitoring data that we're gathering is that there's lots of low-hanging fruit that an organization can fix quite quickly. Many of those, 9,500 errors that we find on average on websites can be addressed in a few lines of code. So there's nothing to stop any organization getting stuck in and doing things today. Of course, some of the issues are a little bit more problematic and take more effort. So it's important to take small incremental steps in your effort. And we're going to continue to monitor at a high level and continuously. And every organization I consider should be using some level of an automatic testing tool at this stage. It doesn't catch every issue, but it's a good way to keep on top of accessibility at a high level in your organization. We're going to continue to engage with public bodies and provide meaningful feedback. And what we say to organizations and public bodies is you need to work closely with your accessibility partner and your web agency in order to address this. As I said, in NDA, we've got a number of accessibility partners. I really feel that every organization, every public body subject to monitoring should have an accessibility partner to help them understand what they need to fix and how to go about fixing it. It's certainly how I, as a developer, learned about accessibility through working with accessibility consultancies and persons with disabilities. So where do we go beyond compliance? Well, compliance with minimum accessibility standards is just the beginning, and it is important to say that, EN 301549, it's a minimum accessibility standard. I have used the term housekeeping. We need to comply with this standard in order to stand some chance of ensuring that our online services are accessible and usable to everyone. But of course, the directive doesn't directly monitor things like the use of plain English, the provision or sign language, or the wider issue of universal design so that it's usable and accessible to the widest range of people possible. So again, the directive is one very, very positive step forward, as I see it, in providing public services online that are accessible and usable to everyone.
You have two more minutes, Donald, to go to before we go to Q&A.
Well, that's perfect timing, Ron, and I'm looking forward to the discussions. So finally, the directive, universal design, Irish government design principles, all emphasize user involvement. So we need to start thinking more as a monitoring body and as public bodies about how we're really going to engage with end users, both in our development and testing of our online services. And this needs to become a reality. And finally, just one thing to say, we're noticing that those web agencies in Ireland that are working closely with public bodies and helping them achieve compliance with the directive are those ones that are actually top of the pile. They're getting national recognition for the quality of their work. And there's an image on screen at the moment of my colleague, Dr. Dónal Fitzpatrick, in his tux, presenting an award to the web agency All Human, which are working with Fáilte Ireland, the Irish Tourist Board, in making their website and services as accessible as possible. So I'll just finish on that, and I'm going to stop sharing so we can open up the discussion. And thanks very much for your patience in listening to me there.
So thanks, Dónal. That was, of course, I'm along with you in this journey, but it's a really interesting process you're going through. So I just love this great summary here. We have a couple of questions here that I want to use our 10 minutes to get those answered as much as we can. So let me get to that list here. And let me start with first answering Mark asked this question, like we did not have the presentation on PDF on the website. It will be here shortly. So it will be available after this presentation. So one of the questions that was asked here, and let me get it here on the Dónal, the question was, how did your organization make the choice of what pages you used on the details and the large reviews on the automatic review? How did you make that selection of pages?
So to some degree we didn't. We chose we used the crawler to start at the home page and set a max number of pages for the crawler to find. In general, that's been working really well. Because it gives a very good snapshot to the organization. Of course, there are large universities. I'm thinking of one in particular that we're working with. They've nearly 500 websites. Okay, so that requires a different level of engagement. Okay, but for your average government agency that has a website, being able to just simply allow the monitoring software to spider 400 pages of the website is working quite well in identifying, the main issues on that website.
Yeah. Well, Hannah's asking a question, and I knew this one was coming, especially in a government track. It is about PDFs. Hannah's in a government organization, and she's wondering, what are you going to do with all your PDFs that are online? Because as we all know, this is one of the biggest pain points.
It really is. It really is, and it's not an issue that I can say is going to be fixed, I think, in the immediate term. There's a couple of things here. First is organizations need to think about why they're using PDFs in the first place. We know that in the UK that there is a reluctance for PDFs to be published on uk.gov. Our own civil service are beginning to realize that PDFs are really not the optimum format for publication to the web, but there are literally millions of PDFs on public sector websites. So our approach and our advice is about going forward, considering, do you need PDFs in the first place? If you do, then ensuring that it's accessible, right? And there are different types of PDFs coming from different origins. It may be necessary for there to be an accessible document program in the organization so that Word documents converted to PDF routinely are accessible. But for every public body who has an external design agencies that's working on, creating PDFs for them, they should be asking now for all of these PDFs to be accessible.
Yeah.
Okay. And that's something that a public body can start doing straight away. So, I wish there was an easy answer to the whole PDF issue. But I think we need to move away from it in many circumstances. We need to start building capacity in organizations to be able to just produce accessible content if we are going to publish in PDF. But we should be asking all our external contractors now to ensure that those PDFs are accessible. And some organizations are already doing that.
Yeah, a lot of people are asking if you have a example that you use where you point organizations to when we're for an outstanding accessibility statement. Like, do you have like the perfect example of an accessibility statement?
Gosh, I don't, but actually a number of them are quite good. So sorry, now you're catching me off the hop there. Yeah, I mean, a lot of them are quite good. So yeah, I'm happy to follow up and provide examples to you. But those of them that are good, they're just simply following the template the European Commission have provided us. So there's no kind of black art in producing a good accessibility statement. The template is there, it's good. A public body just has to copy it.
Yeah, what I just did, I just put the web access monitor email address in the chat. So anybody who wants that example, they can reach out to you, right?
Yeah.
Yeah. Okay.
Absolutely.
Some more questions here. Do you have done any awareness raising to the complaint mechanisms to the creator public? Often people seem not to be aware of the possibility to officially complain.
Yeah. we have, in as much as we mention it in our webinars, but it really doesn't seem to have been enough. So our plan is for this year to engage with the Ombudsman for Public Bodies, which is the complaints organization that someone can escalate a complaint to work with them to see what exactly is coming through to them. I think, you know, this really is a grassroots issue, you know, so this needs to be worked on with the disability persons organizations. And I know that there's a European project, for example, that is looking around educating and empowering people to make complaints. And, you know, we've spoken with one of the lead project managers in that. So it's something that I'd be interested in doing in Ireland, but really that part of the directive, as I see it, really we haven't gotten off the ground in Ireland yet with that. Yeah.
So we have a few more minutes. So let's find answer two more questions. One is, and try to keep it short. Do you have a strategy in engaging with your public bodies at scale? Engaging feels like a one-on-one approach. Would love to learn how you do this across many teams and maintaining that engagement over time.
So we've lots of learning around that, and NDA just doesn't do monitoring around the Web Accessibility Directive. We're currently engaging in a one-to-one with public bodies, which has been really quite burdensome. It's taken a lot of time to reach out to the public body and get them engaged, get them registered on our monitoring and reporting platform. A colleague of mine who monitors the level of employment of persons with disabilities in the public sector uses a very different structure, much more hierarchical, where every government department sends out information and gathers information from the agencies under their remit. That's certainly a model that I'm looking at. The difficulty is, or maybe the blessing is, that the definition of a public body in the directive is really wide. So many of the organizations that we're monitoring, they don't necessarily report to a government department. So that structure kind of breaks down. But it's a really interesting question, and it's been probably the hardest nut to crack for us in the monitoring team. The technical stuff, we feel we're kind of on top of. That engagement piece is ongoing.
Yeah. Helen and some more people are asking, and you already talked a little bit about the procurement process, but how did you settle on DQ as a partner for tooling and achieving accessibility scale? What factors were important in your decision-making process?
Yeah, so transparency, replicability. You know, I was quite surprised actually that some of the responses we got back didn't seem to be reading our very, very detailed public procurement request for tender, which set out exactly what we wanted and how it needed to align with the directive. For some responses we got back, it was just, here's an off-the-shelf product, here's an off-the-shelf service, and we'll multiply by the number of sites you have. And, you know, we were talking about telephone numbers in terms of cost, right? So, so there really was that element to this around addressing what our needs were. So that was the process. But again, you know, if people want to email me, I'm happy to share, you know, what we published in terms of our requirements as well. But I was, you know, kind of paranoid about the whole replicability and transparency piece. I didn't want to be going with any vendor where I couldn't see exactly how they were conducting those tests, and we could show that to a public body, and they could conduct those tests and come up with the same results themselves.
Yeah. We need to finish this session, Dónal. I want to thank you very much for your presentation. I want to thank you all for being here. You participants watching and listening, being active in the chat and asking really interesting questions. Dónal can probably answer some questions offline after the meeting, so we collected all the information. So he will get back to you on that. He promised that he promised that before the meeting. So, and of course, also many thanks to our ASL interpreters. Enjoy the rest of the conference, and thank you very much for joining.